Good afternoon. My name is Frank Haney and I'm the Winnebago County Board Chairman. I want to welcome you and thank you for being here today. I have a few introductions to make. To my right, Dr. Sandra Martel, the Winnebago County Public Health Administrator. The Mayor of Rockford, Tom Mcnamara. From the Rockford Area Convention and Visitors Bureau, John Groh. And from the village of Roscoe, we have President Mark Zula. I want to start out today by saying that there are no confirmed cases of the coronavirus in Winnebago County. However, agencies throughout the county have been working together over the past several weeks to prepare for the potential of this to hit our area. In fact, today we opened a countywide emergency operations center to ensure a coordinated and consistent response. Our first priority is to keep our community safe and healthy. We are taking proactive steps today to ensure that that happens. And with that, I would like to introduce Dr. Sandra Martel, Public Health Administrator of the Winnebago County Health Department. Thank you.
Thank you, Chairman. We brought you together today to make an important community announcement. In an effort to prevent the potential spread of COVID-19, we're announcing that we are suspending all public gatherings and events of 25 people or more until further notice. This suspension includes things like the St. Patrick's Day Parade and Patty Fest, as well as large sporting events in our community, fundraisers, concerts, and performances. It does not include essential services like schools, child care programs, government, including polling places, healthcare, and regular commerce that would occur at restaurants, grocery stores, and other businesses. The important thing to take home is we are doing this as extreme precaution to prevent community transmission of the disease. And I would like to reiterate again that there are no confirmed cases in Winnebago County, and we want that to remain. Social distancing has been recommended as a community mitigation, meaning a community prevention strategy. It's important that individuals recognize that we are doing this to protect their health and safety. The health department is also restricting visitors to long-term care facilities, except in such certain circumstances such as end-of-life decisions. We recognize that this is a very critical time for individuals. And our most vulnerable at-risk populations are those that are contained in long-term care facilities and skilled nursing facilities who are advancing in age and or have chronic medical conditions. The health and safety, again, of the community is our most important priority. Since there is no vaccine, there is no way to control the spread of the virus except through community mitigation standards. While most people won't get seriously ill, we know that there are vulnerables in our population that will experience illness that needs additional medical attention. Our healthcare facilities are prepared and ready to respond for them. If you have symptoms of coronavirus, please contact your physician's office, your urgent care, your emergency department before going in. It is critical that the teams be aware and be able to prepare for you to come into the centers. The best prevention is to stay home when you're sick. We cannot reiterate that enough. We've talked about hand washing, simple protection that you can do every day. But we are also then implementing these additional guidelines and standards so that we can ensure that our population is protected at the highest level that we can do that. We recognize that this is very disruptive to our community and our everyday lives, but we want to disrupt the transmission of this virus. And to do that, we need all hands on deck. We appreciate the support of our elected officials, our business community, our event sponsors, and our community. They have come together to respond and prepare and really develop plans that are appropriate for our community. So once again, we are suspending community events that are non-essential for individuals with more than 25 people. I think this becomes difficult for everyone to understand or comprehend, but the important thing is that we are doing this so that we can enforce social distancing in all of our locations. I want to thank you again for your support in getting the word out to our community. This is a critical time for all of us. Next, I would like to introduce Mayor Mcnamara, who is the mayor of our largest municipality in Winnebago County, representing 50% of our county. In addition, we are the third largest city in the state of Illinois, and we have to take additional precautions for our large population base. Mayor Mcnamara.
Thank you. Thank you, Dr. Martel. First, I just want to say I understand that this has been a terribly difficult decision, and I would first say that this is no time for citizens of Winnebago County, for the city of Rockford, and citizens in our region to panic. This is simply a time for citizens to be prepared. And if you look at the history of what we've done in our county, when we face challenges, we face them together, and we always get through those challenges. And I think one thing that I've taken from this most recent challenge that we're all facing is when we come together, we're a lot stronger. When you look at the leadership that Dr. Martel has provided with the Winnebago County Health Department, you look at the coordination with the other governmental bodies, you look at the coordination and the amazing work of our first responders and our healthcare systems, all of us are coming together with one common goal. We want to make sure that we are utilizing proactive measures that put the health and safety of our citizens first and foremost. Again, this is certainly a difficult decision. I empathize with the business owners when you just look at this weekend and what's at stake for many of our small business owners in already a really difficult season, post-holiday, pre-summer season. For so many retailers and restaurants, I understand that this is a tough time, and then on top of that you add these measures. We understand that, but being proactive to me, and the decision of the Winnebago County Health Department in collaboration with all of us, to me is really the wisest, best move for us as citizens for all of our communities. With that, I would like to introduce the President and the CEO of the Rockford Area Convention and Visitor Bureau, John Groh.
Thank you, Mayor. Good afternoon. As the Mayor said, my name is John Groh, and I'm the President of the Rockford Area Convention and Visitors Bureau. And I just want to make a few remarks on behalf of the region's hospitality and tourism industry partners. I do want to express, on behalf of the industry, our appreciation to Dr. Martel and her staff upon their leadership in really addressing this issue head-on and being proactive. I think the worst thing that could be done is that action isn't taken, and potentially the outcomes become even far worse. So taking swift action and appropriate measures to minimize the transmission of the virus through community spread, we believe, is a prudent step. And while we all want to gather together for the St. Patrick's Day Parade and other community events, taking steps to minimize large group gatherings and to ensure social distancing is appropriate, especially at these times. However, as the Mayor alluded to, I do want to really encourage people to take this time to remember our small businesses, our restaurateurs, our retail establishments, and continue to support them. There are no restrictions on going out to eat or being in public spaces, again, reminding people to be mindful of social distancing. Other places like our museums, our parks, our forest preserves remain open and welcoming to the public, and as the spring approaches, spring break trips come up, those types of local entities, local businesses, local organizations remain open to our community. And as you're traveling about the community with your family, your friends, and small groups, I think those are really appropriate options. And remembering our small businesses and their employers during these times are very important. And remember, even in times like these, we're still all Irish on St. Patrick's Day, so as you gather with your friends, enjoy the luck of the Irish, and may it be with us. Thank you. Dr. Martel or Chairman Haney?
Any questions?
Yeah, I have a question. Probably Dr. Martel, best for you to answer this. And this is coming directly from our viewers who have concerns about their health. Most of them saying that they're concerned that they are experiencing symptoms or a loved one have symptoms that they think could be the coronavirus, and they go to their doctor, and their doctor says they cannot get tested. So what are the protocols? What are people supposed to do if they fear that they have this virus, even if they don't fit criteria of, I haven't been traveling, I haven't been exposed to somebody that I know has COVID-19?
Well, this is where the clinician comes in, and so each of our healthcare partners and systems, the clinicians are trained to do a complete assessment to determine the risk of COVID-19. At this particular moment, it takes about 72 hours for a test to come out of our Illinois Department of Public Health laboratory. So we're gearing up in the private lab sector. You've heard about LabCorp and Quest. They have not fully come on board in all the areas of the state and the nation. As time goes on, but right now the most important thing is to get individuals who have symptoms of COVID with exposure of COVID-19 to be tested for COVID. And so we are making sure that those are our high priority for testing.
And I have a follow-up question to that as well with the testing. Are there plenty of tests available in Winnebago County for people in this virus?
Right now, the tests are not in. I want to explain the testing procedure because I hear a lot of those kinds of questions. First of all, every healthcare provider in our community can take the specimen, which is called a nasopharyngeal and oropharyngeal swab. And at that point, they also then are testing for influenza A, influenza B, and doing a complete respiratory, what we call a respiratory viral pathogen panel. The test then is submitted to the State of Illinois Laboratory Test, who is right now in our state, is the laboratory that is certified and credentialed to perform the COVID-19 testing. So then they would submit those down. But right now, the priority is for those individuals who have risk of exposure and have the symptoms to be tested.
What does the testing involve? Is it just looking at it on a microscope, or do they have some sort of...
It's called a Pcr test, and we can get you the details on the test itself. It does not go under a microscope. They don't grow. It's actually a polymerase chain reaction test.
And is there a physical kit that they need in order to do that?
There's a kit and reagents, and again, most laboratories, for any laboratory test, you have to be credentialed to perform that test.
How many tests have been sent from Winnebago County, or how many samples have been sent from Winnebago County to be tested?
I can get that number. I believe we've had 9, but let me get the exact number for you. But all of our test results to date, I believe we have 3 still pending at the state lab, have been negative.
And I also want to follow up on something you said earlier about being prepared to respond to people who get seriously sick. Is there a number then? Are we talking about half the population? What is the preparation? What is the threshold that the county is prepared to handle if this becomes a massive outbreak in our area?
Well, I think as we're beginning to look around the state, we recognize that, again, most individuals, when you look at the data that's coming out, most individuals have a mild form of the illness and completely recover and can be cared for at home without any supportive measures. It's individuals, when you're talking about, that have underlying health conditions, diabetes, hypertension, cardiac, and are advancing age, above 60 years of age, that have the poorest outcomes. So then, again, they would be the ones that we would be worried about and most concerned about moving them, transitioning them into hospital care as needed.
So what's the percentage then of our population that we're most concerned about?
In terms of the percent of population of chronic disease,
In terms of the population that's most at risk for this virus?
the population most at risk, in terms of risk category, are those over the age of 60 and those with chronic medical conditions.
Do we have a number of that, though?
We can provide a number from our, data from our population statistics.
I would think moving forward that communication would be a really big thing here, and obviously we can do our part with sharing what you were telling us. But I'm also wondering, moving forward, if you have a plan for communicating with the public on what they should be doing, because I think there's a lot of misinformation that can be spread, whether it's people seeing things online or just rumors, word of mouth. I was wondering, what specifically do you have in place to communicate with them?
Well, first of all, we've had a joint information center that has been operating for the last several days to respond to this. As you would guess, they have to look at all the social media posts. People are calling in saying, I have this, I have that, I heard this was closed for this. And we are going to always put out official information. So the Joint Information Center goes through those, determines what should be put out in terms of factual information. We want to make sure that the public is getting fact-based. That's one of the other preventive measures, I call it, in order to reduce panic, is to get fact-based information. So the recommendations came out earlier in the week, and we did put that out about individuals most at risk. We talk about the age over 60 and those with chronic medical conditions, and we know there is more in the younger population that have chronic medical, so we want to make sure that we protect them, which is why we've really put these enhanced community gathering regulations out there. And again, voluntarily, our teams all came together and said, we believe that this is in the best interest to discourage people from getting out in the public that may be exposed unintentionally and may then be contract the illness.
So I think you said there might have been about 9 or so that have been tested. Is this a number that you'll continue to update to the public?
It is updated on a daily basis in terms of, as part of our counts. What we have not done, and I think people get, what we've really been cautious about throughout the nation, throughout the state, is what we call in that PUI category, persons under investigation, and understanding why. Many of them are quarantined or isolated at home. And again, what we don't want is people making assumptions about who that is, where they're at, can they be outside. We are following up. We want their voluntary compliance. We don't want to have to go to court to get those orders. So it becomes very important that we work with them, that they want to voluntarily comply with us, so that we don't have to put that out. You know, we get calls all the time. Should they be outside? You know, first of all, you know, we don't publish who that is. And in the community of this side, when you get small numbers like that, you have to be very cautious about protecting the privacy and the confidentiality of the individuals. When you get to community spread, and you're hearing some of that coming out of Sacramento, California, where they're basically saying stay home, and they're not doing a whole lot of work on that, that means it's been out of, the numbers are large at that point. So again, we're really working to make sure that we protect the individuals, confidentiality and privacy, that we're doing the contact investigations that are appropriate for every single one that's a potential case that says I've been exposed. We have to then go and interview to determine all of the potential contacts. That number can get very large. We know people share things on social media and say, I heard, but every single one of those has to be investigated. And that takes time from the public health department. It may involve first responders who responded to the call. It's a large web that gets sent out to be able to investigate and confirm, and then make the appropriate decisions and protect the confidential privacy. We have made a commitment all along that when we have a case, we will then go forward and announce that we have a case, as every other county in Illinois has done.
The ban with people, you know, over 25, how long do you expect that to last?
We're going to evaluate that on a week-to-week basis. And the reason people have asked about 25, you know, it really identifies, typically we can identify who those 25 people are that are an event. You think about if you go to a fun event at the BMO Center, how many people are sitting around you? If there was an exposure there, how large would that net have to be cast to investigate? And then you begin that process of 25 is something we can control in terms of looking at who was there, who participated, and then appropriately taking the actions that might be needed, whether it's quarantine with that individual, testing, or if they become ill isolation.
To clarify what you were saying about the schools, you said that schools weren't going to be closed for this, but what about after-school activities, extracurricular activities, that kind of thing? Do you know
Okay.
about those?
After-school activities, we're considering essential activities, so like things like the community center where kids go after the school day to complete their work. They're considered essential childcare. You know, they provide activities and support for school activities. And remember, the school-age population has not been our highest risk population. And those events and venues, typically you have to register, you have to know which children are in there, so we have a controlled environment in which we know who could have been impacted.
What about sports? That kind of thing.
Again, because they can do that, what we're not, you know, again, we have to think about that in terms of making sure that they can promote social distancing. So we've been talking about that. And social distancing for this disease is 6 feet apart. So this is not the time we do a lot of huddles and things like that, right? You gotta have to figure out, you gotta disrupt it, do it a little differently. And I think that we have enough creative people in this community that can help us think that through. But each scenario they will prevent. We've, you know, you'll see some events are being live streamed with no, you know, I'm gonna say no observers. I know that's difficult for families that want to cheer it on, but it's for the protection of the community. And again, making sure that the children are safe as well, making sure that we don't put them in situations where they're less than 6 feet for extended periods of time.
Was there Coronado, or is it Coronado that's being canceled?
I believe there are Coronado events being canceled as well.
What about city council and county board?
Government is considered an essential function, and so they will continue.
Is there a protocol for first responders if they come across someone with the coronavirus?
Yes.
What does that protocol look like?
It's extensive, and there is guidance that has been issued by the Centers for Disease Control and response about how first responders, first of all, every single one of our 911 call centers, they also call them PSAPs. I'm probably not good at the terminology of what that all stands for. But they have additional screening questions that they will ask individuals when they call to determine what level of PPE they need to wear going into the home or the scene to be able to respond. And then they will take the appropriate action, then take the handoff to the hospital. They will notify the hospital so that the hospital make preparations that they go into the right. Again, the idea being we want to minimize the number of people they're exposed to.
The number one question we're getting as we're streaming this live is about schools. People are concerned about sending their children to schools in large groups, in large classrooms, especially little kids. So what do you want to say to parents right now about sending their kids to school?
At this time, there are no cases in Winnebago County, confirmed cases, so we believe that the school environment and the risk to children is low. If we were to have an event where there is a child, we would work through the school system to determine the best course of action. And again, each school scenario setting is different, and so when people ask, is there a universal? And the answer is no. It depends upon what grade we're teaching in. It depends who the case is, the confirmed case. Is it the adult or is it a child? And then how do we take the appropriate steps? Do they change classrooms? Who are their lunch mates? What after-school activities do they participate in clubs? Those are the kinds of things. With children, we can very much track their activity. We are not restricting anyone from doing what they normally do. We're closing down large venue events and groupings where we think that the risk of exposure could be large, and really with not knowing all the level of community virus to be able to determine that.
I just wanted to clarify too, that includes the RBC tournament this weekend, so they're no longer coming from New York, the team?
The Rock Valley College teams are already in place. There are no spectators. They are running the tournament without spectators. Now before, I'm going to tell you a little pre-lead onto that. In collaboration, we vetted every single team, where they were coming from and the disease level before. So as we began to get closer, when this event was going to kick off, they are also, if you look on the streaming event, you'll see the athletes are sitting in the stands and they're 6 feet apart. They are not allowed to sit on a bench along the area. And they are monitoring again. You're not going to see 25 children, players on the court at the same time.
Any other questions?
I have a question for Chairman Haney. As far as the economic impact, what do you think it will be? You guys sort of touched on that earlier, but what will be the overall economic impact, do you think, from all the bans that are in place here?
Well, I think what you're seeing today, what you've seen over the last several weeks, is that there's a concerted effort by medical professionals and leaders like the folks to my right and those throughout the community to be proactive and instead of reactive. And by being proactive, we are going to minimize long-term impact to health outcomes, minimize impact to economic disruption. Is there disruption? Absolutely. Is the goal of what you're seeing talked about today by Dr. Martel in partnership with many others in the community, an effort to minimize economic impact? Absolutely. When you look at economic impact, you're talking about everything at the macro level, from markets to the national economy, but then more locally, I think what you're seeing is, yes, there is disruption socially to our patterns, as well as business disruption. We do want to minimize that, but by being proactive now, we do believe that that puts us in the best possible position later to have the least amount of real economic impact to our region.
Are you recommending that churches not hold services, or maybe just your social distancing at church? Or
I'll go to Dr. Martel on that. Sorry.
We have pushed out guidance to faith-based services so that they can put in place procedures to, again, increase that social distancing. Many of the community-based churches have already done that. Some of them have live stream capability. Some of them will do different kinds of things to ensure that again, we understand that is an essential part of many people's lives. And so we want to make sure that we are promoting as much safe procedures as possible. Again, health and safety are our primary concern.
And speaking of primary, actually, that's going to be next week in Illinois. I was wondering, I'm assuming that that's going to be something that's considered essential. Is there going to be any practice for social distancing? I'm sure that there will be people who gather there.
We can both speak to that. We have spoken to our election authorities for both Winnebago County and the city of Rockford. They have already taken proactive stances regarding, first of all, you heard about the long-term care facility, so they have moved polling places out of that, right, because we're not allowing individuals in there. We are encouraging in our public information group through the Joint Information Center has really been pushing out the word to get the vote out early. You do not need to be hanging out at a polling place because, again, we are concerned about our election judges and the capabilities and capacity of our election judges. And also, again, the concept that we want our election system as an essential function of our democracy, and we need to make sure that that continues.
Can anybody speak to the impact this might be having on the airport in Rockford?
So before the airport, I would just add to the primary election that's coming up. Every single day from now till Election Day is Election Day in the state of Illinois. Get out and vote. Obviously, the parade, St. Patrick's Day parade this weekend is canceled. Go vote. Don't wait until everyone is going to vote on that on Election Day to do that. Every single day from here to the Election Day is Election Day. You have that opportunity. Winnebago County and the city of Rockford's election authorities have really wonderful hours that allows nearly anyone who wants to vote the opportunity to vote and vote early. From the airport, you know, and having conversations with the airport, they're certainly monitoring activities. I think a number of you actually have done stories on what the airport is putting in place, but we're certainly monitoring what's going on there and monitoring those folks who are traveling to communities that have already had such community spread.
I would just add on the election side, our Winnebago County, our clerk, Clerk Gumau, has done a great job preparing for Election Day as well as the lead up. What I'd also say, there is no excuse for not voting. Practice good, wash your hands and practice social distancing. That's all you need to do, and then show up and vote. And now you heard it from a Democrat, you're hearing it from a Republican. There's absolutely no reason you should not participate in the democratic process. Any other questions? Okay, thank you.
Thank you.
Thank you, everybody.
Thank you. Excellent.
That was the fire department.
That one, the Northern Illinois response, the one they're talking about.
Oh, yeah, of course.